it over here. Contraction on the biceps muscles is the normal response. Similarly on the left side, expose the part of the biceps. Okay, try to hold the biceps tendon with the thumb. Okay, and try to strike with the narrow end of the patellar hammer. Okay, you can see contraction of the biceps muscles. Okay, now on the right arm, the supinator jerk. For the supinator jerk, supination. Okay, we have to do this movement. Okay, we have to strike on the styler process. This is the styler process with the help of this narrow end. Okay, before doing this, we have to do this dorsiflexion of the hand and try to strike over here. Okay, normal response is the supination will be there. Okay, just try a little bit pull the dorsiflexion, the arm. Okay, hold it like this and strike it over here. Try to strike over this area. Okay. Then triceps. This is the triceps. Expose the triceps muscle. Okay, this is the tricep muscle, and normal function is to extend the arm. So we'll try to strike in this particular part of the arm. Okay, with the broad end of the hammer. Okay, 90 degree we have to place the arm and we'll strike at this particular end in between the two condyles and the olecranon. Okay, like this. There will be fine fibrillary contraction on this particular part of the body. And on this part, similarly, we'll hold this arm like this, and we'll try to expose this muscle, and holding like that, we will strike in this part. Okay, there's a good contraction being shown over here. Okay, these are the two examinations of the upper limb. Now we move on the abdomen. Abdominal just. For the abdominal muscles, we have to do the examination with the help of the narrow end of the patellar hammer. Okay, so T1 thoracic fibers, we are going to do the examination. Okay, so medial to, so lateral to medial we have to move. Okay, so first like this, like this. Now so muscular. So upper bilaterally, middle bilaterally, lower bilateral. You can see vibration and contraction of the abdominal muscle. Okay. Then moving on to the next examination, that is the knee jerk. Okay, for this we have to expose this whole quadricep muscle. So as such, we are not being able to do here. So we can do this examination like this. In the lying down position, we will be holding our hands, holding the legs, knee joint like this, and try to locate the patellar tendon. Okay, ligament patelli. With the help of the broad end on the patella, we will try to strike it over here. Okay? And make sure the whole hamstrings, this quadriceps is exposed. We have to see the contraction of this particular part. Okay? Okay. As such, you can see there is a movement of this limb, but this is not the contraction movement or the reflex, but the response is elicited by observing the contraction of this muscle. This part we have to do the examination like this. Or give support to the knee joint. Try to strike this patellar ligament patelli like this. Okay. Okay. This is the patellar reflex. Then we have the ankle reflex. Okay, ankle jerk. So for this we have to just crisscross the legs and we have to expose the gastrocnemius muscle. So at out here, out here. Okay. So this is the muscle. The response of the contraction of this muscle we have to see. Okay, for this, the part, the leg should be exposed and the limbs, the ankle joint should be slightly dorsiflexed, okay, in order to make this tendo-achilles tendon prominent. Then we will strike with the help of the broad end of the patellar hammer here. Okay. You can see there is a contraction in seen over here. Okay. Similarly, expose this part, crisscross the limbs, slightly dorsiflex it. Just keep on your vision over here and try to see for the contraction. So sometimes it doesn't come because the patient becomes aware. the examination. Okay. The last examination for the reflex is the plantar reflex. For this we have to, before moving forward, we have to make sure there is no undue contraction on the toes. Okay, so for that we have to fix this foot with the help of our index finger and the thumb on the malleolus, and try to see whether there is undue contraction on the ankle joint or on the toes. Okay, great toe or down the toes. So you're all moves. Okay, then you fix it. Then you try to stretch the outer surface of the sole. Okay, we have to move from the heel and to the base of the pinky finger, and then we have to move medially towards the greater toe. So normal. This is the normal response. Or what we do get in the response as the plantar flexion of the great toe, okay, and adduction of all the toes. Okay. Similarly, in this ankle joint, just check the toes. Then we'll move from the heel. Okay, so there's a flexion, plantar flexion of the toes, and there's an adduction. The abnormal response is that you will get extension of the dorsiflexion of the great toe and fanning out of the toes. This will be the abnormal response. Okay, this is also called as Balanced response. Okay, so this is the examination of the reflex.